There we go. Okay, so welcome again, everyone, to our webinar with our behavioral health partner, Lucet, on mental well-being for parents. I'm very pleased today to introduce Katherine Wooten. She's the Senior Director of Clinical Strategy and Research for Lucet, and she has over 2 decades of experience in direct clinical services and managed care leadership throughout the U.S. And with that, Katherine, I'm going to turn the microphone over to you.
Hi, can everybody hear me?
I can hear you. I think you're good, Katherine.
Okay, good. So everybody, thank you so much for being here today. This is a topic that is really near and dear to my heart. I think the timing on it is fantastic, being as we're right between Mother's Day and Father's Day. It seems like a really good time to come together and celebrate all that you do as parents, and to really talk about an area that I think all too often gets overlooked. And that's the fact that as parents, you know, you're doing so much for others, but you've got to take care of your own needs too, and we need to help you do so. So just kind of really quickly want to hit on a disclaimer. This information is for informational purposes only. I am not here to, to give you medical or clinical, legal, professional advice of any sort. Both Florida Blue and Lucet have really made an effort to present complete and accurate information here, but cannot warrant that it will be complete, accurate in the future. Things change. So, please give us some grace there. What we're going to be talking about today, first is just to recognize the signs that a parent may experience related to their behavioral health. You're going to hear me say mental health and behavioral health here synonymously. Also discovering what a supported parent and a healthy support system looks like and how that can positively impact children. So I want to start by just talking about what is parenting, what is the reality of parenting, what do the challenges look like, and also what is well-being. We use the term a lot, but very few people, I think, if you put them on the spot and said, can you define it, would be able to do so without really thinking about it. And when we say well-being, what we mean is just an overall positive, hopeful mental state. You've got that sense of purpose, what you want in life. You feel satisfied with what's going on in your life, your work, your relationships overall. And you feel like you've got the capacity to adapt to stressors, that when something goes wrong, you'll be able to rally and to handle it. So I think when talking about parenting and talking about downsides of parenting and the stresses of parenting, it's important to say we're not at all trying to say parenting is bad. Parenting is wonderful. It can be very fulfilling. It can be very full of love. It can be, the absolute most rewarding thing you do in your life. But we're doing parents a disservice if we don't recognize that it also comes with a lot of stressors. And I think ignoring those stressors is a very dangerous thing to do. It makes them worse. So let's be honest, there's a lot of stress in raising a child, both emotional and physical. You don't get as much sleep. You've got pressure you put pressure even on yourself to make the right decisions when maybe you don't know what the right decision is at any given moment. You're just trying to figure it out as you go along. There's also, I think, a lot of pressure from society. I see all of these moms and they have good intentions, but they often devolve into this space of criticizing parents and making parents feel worse for the decisions they make. And you'll see people, if like, let's take breastfeeding example. If you do it, oh, that's bad. If you don't do it, oh, that's bad. And so a lot of times it's kind of a lose-lose scenario where you're going to get critiqued no matter what you do. So there's a lot of stress inherent in that. Oh dear, I'm hearing that sound is breaking up some. Gosh. All right, keep me posted if it keeps happening.
I'm hearing you, Katherine. I'm hearing you okay. It was a little wobbly here and there, but I'm hearing you okay right now.
Okay, good. So let's talk about how parental well-being impacts children as a family as a whole. In other words, why does it matter that parents are healthy? And the reason it matters is because parents' good well-being, their mental health and well-being are really at the heart of the whole family being healthy. When you are healthy, when you've got well-being, when you are resilient, you're able to be emotionally available for your children. You're able to be more patient. You're able to foster the environment that your kids need in order to thrive and to grow. You're able to model the skills that you want your children to learn. So let's talk about what are some of the common mental health challenges that parents face. Burnout. You're exhausted. You've got so much on you that it's really easy to just lose your energy and burn out. There's anxiety. Am I getting it right? Oh my gosh, my child did this new thing and I'm stressed out about it. There's compassion fatigue. Let's be honest, kids have big emotions, and sometimes those can be hard to deal with. When your child is coming, you absolutely just, going bonkers about something that to you seems really small, but to them seems huge. It's easy to have that moment of, ugh. And we call that compassion fatigue. Sleep deprivation, I think that's every parent most of the time. Emotional exhaustion, which can be kind of the precursor to compassion fatigue, and even depression. I think once you notice that you're having some of these symptoms, the next step is figuring out, well, do I need help? How do I know when I need help? And I think it's really when you're having any of these symptoms, but particularly when they persist, when it's not just a few minutes or even a few hours. I've had a bad day, but with some sleep tonight, I'll wake up fine tomorrow. But if it's not like that, if it's day after day and you're feeling this way, that persistence is sort of what we're talking about. The feelings of overwhelm and hopelessness, changes in sleep or appetite, difficulty connecting with others. I think hopelessness is a really, really big one to talk about there. So, there's kind of this continuum from normal stress to behavioral health, mental health conditions. And there's not any just super clear cutoff that, okay, this is normal, this isn't. I think it's really important to pay attention early on when you're starting to have symptoms so that you're able to address them, hopefully, and get the support, hopefully, before they become an actual behavioral health condition. So let's talk about what you should look for in both yourself and others. First of all, 75% of women impacted by maternal mental health conditions don't get treatment at all. That's huge. That's 3 out of 4. 1 in 5 mothers are impacted by mental health conditions. And when I say mental health conditions, maternal mental health conditions, it's the most common complication of pregnancy and birth. Not hypertension, not preeclampsia, not diabetes, mental health conditions. When we talk about emotionally, that may look like, again, feelings of overwhelm, helplessness, I don't know what to do, and just this kind of deer in the headlights feeling, nothing I do is right. Anxiety, again, just that feeling of I don't know what to do about this, worrying. I think it's, every human being worries some. The question is how much you're worrying. Feeling emotionally disconnected, just kind of flat maybe, not feeling like you really connect with your child, with your spouse, with the people around you. Feelings of flatness and depression. Physically, it may look like exhaustion, constant, you can't sleep at night, or all you want to do is sleep. You're having trouble waking up in the morning. You're having trouble getting out of bed. You might have headaches, body aches, just tight muscles, tension, and changes in appetite or weight. Either you're hungry all the time, you can't stop eating, and you're using that to kind of medicate your emotions, or you maybe can't bring yourself to eat. And I think it can be hard to overlook that one because sometimes, especially with a newborn, you're so busy that you don't necessarily make time to eat. So it's important to keep an eye on that. And then behaviorally, do you have increased anger outbursts, increased frustration? Are you being, I used the word to describe myself just earlier this week, grouchy. Are you stressed out and you're being grouchy at people? more than you usually would? Are you avoiding or struggling to keep up with your parenting duties and your other daily responsibilities? And we're looking at things that are out of the ordinary. Not just are you busy, but are you less able than usual to keep up with the specific amount of work on your plate? Are your family or friends commenting that you seem withdrawn, or do you feel more withdrawn than usual from them? And self-care, again, it can be hard, especially in those infancy days, the newborn days, to find time for self-care. But when you do have the time for it, are you having trouble finding the energy for it? So looking beyond burnout, talking about specifically postpartum mental health conditions. We talked about the fact that these are the most common complication of pregnancy and birth. And these three conditions here are really the three big ones. There's postpartum depression. That's probably the one you've heard the most about. And that's the kind of depression that some people experience after birth. Sadness, hopelessness, lack of interest, lack of willingness, ability to engage in activities. And sometimes this can impact your ability to bond with your baby. And I find that is a really dangerous thing for mothers because they really blame themselves for it. They really feel like I am failing. And it's not. It is not you failing. It is a chemical imbalance brought on by the hormone changes of giving birth. And it's really important for all of us, for pregnant women, for newborn, new mothers to recognize this, but also for all of us on this call to recognize these symptoms in others, because there's so much stigma attached to this and so much self-blame I see here. And so often that when I speak to a mother with a new baby who's experiencing these conditions, it's so common for her not to be able to see that what she's going through is biochemical, not just, so often it's, oh, I'm being a bad mother. I'm a bad mother. I don't know what I'm doing. That's not it. The next condition in this trifecta is postpartum anxiety. And again, this looks like just regular anxiety, but it is anxiety specifically that is part of the postpartum process. So anxiety that looks beyond just normal worries. Gosh, my baby is coughing and I'm worried. That might be normal, especially with first baby. Like, is it dangerous that my baby's coughing? I don't know. I'm a new mom. Or is it just constant anxiety and worry? Symptoms might include worrying about the baby's safety, panic attacks, feeling of being overwhelmed. It's different from depression, but they can occur together. And the third one, and the rarest of the three, is postpartum psychosis, which is a condition, again, in this case, specifically related to having recently, within the past weeks or months, given birth, that comes with hallucinations. You might be seeing, hearing, smelling, or tasting something, or feeling something that doesn't exist, that people around you are not experiencing. Delusions. Maybe you believe something that's not true. You believe that your baby was switched in the hospital and this is not your baby. Or your belief that, something that is very obviously not true to the people around you, you firmly believe is true. Disorientation. You're not quite sure what's going on, where you are, what's happening. Mania, which is just a very high level of energy and irritability. This can be a very dangerous condition. All three can be, but this one in particular, all three need psychiatric intervention, but postpartum psychosis the most so, because at this point your ability to make decisions is severely impaired. So if you see somebody, anyone you know, anyone you love who has any of these symptoms, you need to address them. Let's talk about what parental support looks like, the difference between a supported versus an unsupported parent. What does it look like when we as parents have the support we need and the resources we need versus when we don't? So when we have support, and by which I mean, you've got the people in your family, the people who you're friends with, the people at work, your doctor, your OBGYN, your a child's pediatrician. Maybe you have a therapist. Whatever supports it is you look like when you have them, you feel confident in your responsibilities. You're able to manage stress. It's not to say that you don't have stress. Every human being has stress, but you have the ability to manage it, to respond to it. You're able to take care of yourself. I love to give the analogy of when you're on an airplane and they talk about the oxygen masks. Everyone knows what I'm talking about, right? When they say if the oxygen masks descend, adults should put the mask on themselves first before putting it on the children who are traveling with them. And I think I see parents sometimes kind of reacting to that idea, but it's true. You cannot take care of your children if you're not already taking care of yourself. You've got to be able to do the things you need for yourself in order to really show up for your child. A supportive parent is able to set boundaries. And that's such a hard thing to do. Let's talk about what a boundary is. A boundary is not a rule for someone else. A boundary is a statement about what you will and will not tolerate. So I can say, I will not let you talk to me like that. That doesn't mean the person can't say anything they want. What it means is you will not stay there and allow that to continue to your face. You will get up, you will separate yourself from the situation. A boundary is something that you do not allow someone to cross. They can be hard to impose. They can be very tempting for people to push those boundaries and to see if they can challenge them and get you to let them down. But I think, in order to be a strong parent, it's important you be able to set and maintain them. A supportive parent has access to mental health services. Hopefully everyone on this call is, because you've got some great resources to you. It's entirely possible we have some folks out there that are not Florida Blue members. Hope that's not the case, but it's possible. I think it's really important to know what resources you have available to you through your insurance company, in your community, whether those are through your church. Now, let me be clear. Churches often have counseling. That is not the same as mental health therapy. Having a degree or even a license in, let's say, faith-based counseling does not mean that the person has any training in mental health. Usually that is more of a religious-based education. So, but at the same time, while you won't get mental health services from your church, that can be a great place to get emotional support. That sense of fellowship, that's such an important part. Also, somebody who can help you when you need off. You need somebody to help with childcare, to help with a meal, or whatever that would look like. If you don't belong to a faith group, that's fine. There are so many other ways to get that. A church, a synagogue, a mosque, or whatever is definitely not the only way to get that, but it is a way to get that. There are all kinds of social groups, and you need to be looking to those for support. And then, again, participating in self-care. But what I love about this last bullet is that it's highlighting the fact that you're doing self-care that can be done alongside your child. So you're not only taking care of yourself, but you're teaching your child healthy habits that will last throughout their lifespan. I love the example of, telling your child, I've had a really busy day. I'm going to go to bed a little early. Or I'm stressed out today. I can feel it in my muscles. I'm a little bit tense. I'm going to go for a walk. Or I'm going to take a hot bath. Or I'm going to do, fill in the blank with whatever it is that you find soothing. And by seeing, oh, my dad, my mom, my grandparent, my aunt, my uncle, whoever's my caregiver does this, it teaches them that that's a healthy thing that they should learn to do. It teaches them to think about those things for themselves. So it's another example of the oxygen mask. By doing something good for yourself, you are doing something good for the children in your life. On the flip side of this coin, there's an unsupported parent. The unsupported parent feels overwhelmed, emotionally drained. Someone who doesn't have anyone they can talk to say, hey, I'm going through this with my child. Is this normal? Do you have any advice to give? Have you ever experienced this? Can you just tell me I'm not, not just losing my mind here, that, what my child and I are experiencing is normal? To become very reactive, frustrated, again, as I described to myself recently, grouchy, taking that out on people, having difficulty managing your emotions. You can experience chronic stress, chronic anxiety. And this bullet point calls out the fact that children really take on their parents' moods. Serene parents tend to raise serene children. Easily stressed out parents tend to raise easily stressed out children. The more you can do to be emotionally healthy, the more emotionally healthy your child will grow up to be. The unsupported parent lacks a reliable support system, in other words, doing it all by themselves, feeling like they've got no one to ask for help, no one to go to when they need something. Kind of that I'm an island, I have to do everything, as that superhero sort of mentality. They're often exhausted, not taking care of self-care. And that's particularly important because what we find is that unsupported parents, parents who are doing too much on their own, have worse physical health as a result of it. Because they do not have support, they are not getting their medical needs looked to, and they're more likely to develop chronic conditions, which in extreme cases could even lead to shorter lifespan. We know that the caregivers of children with disabilities tend to have shorter lifespans because they are often doing so much for their children that they neglect their own needs. So a lot of times, I think the caregiver just doesn't know what resources are out there, doesn't know how to access them. Maybe yeah, insurance would cover therapy if I needed it, but I don't know where to find a good therapist. I don't know how to get to one. Like, how do I even know if I need therapy? All of those questions. That lack of knowledge about either the fact that you do need support or how to access that support. And spoiler alert, please call your insurance company. This is our job, is to help you figure out if you need help and to help you find the right help for you. Lucet loves getting these calls. If you're looking for therapy, if you're looking for psychiatry, by all means, let us find that for you. A lot of times, an individual will call 2, 3, 4 practices, be told, oh, we don't have any availability for the next few weeks, and they'll just assume that's the way that the world has to work, and they'll say, okay, I guess put me on your wait list, I'll see you in a few months, or they'll say, well, I just give up. It can get you an appointment much, much, much faster than you can probably get on your own. So call us. Let us do the legwork. This is what we're here for. Going back to this idea, and you're going to hear this as a real theme throughout my talk today, about the importance of prioritizing yourself and your own needs. You cannot help other people if you're not first taking care of yourself. So, self-care. I love this topic because there's this feeling, I think, or this myth that a lot of people have that self-care has to be big and extravagant. It has to be expensive. Ooh, self-care is a day at the spa, and I don't have money for that. I mean, if you've got the money for a day at the spa, fantastic. Or I don't have the time for it or whatever. If you've got that, fantastic. By all means, do it. But don't let the lack of time or money prevent you from taking care of yourself. It can be taking a hot shower when you're feeling physical. So it can be calling a friend to say, I've got 5 minutes between meetings. I'm feeling stressed out. I just needed to hear your voice. It can be, it can be really anything. And the important thing to realize is that as much as we all enjoy it, well, for me, it's a day at spa. For you, it might be something totally different. But as much as we all enjoy that big, extravagant thing, that's actually less effective for our ongoing health and well-being than small, consistent gestures. Taking that walk, taking that hot shower, calling that friend regularly, day after day, week after week, has a much bigger impact than that occasional vacation, that occasional, big extravagant treat. Ooh, that nice pair of shoes I bought myself. So I'm certainly not saying don't take vacations. That's actually also, taking time off of work is a huge predictor of well-being. So I'm not saying don't do that. Please do that. But please don't put off small self-care until you have time for big self-care. Keep doing it all along. Self-care is so important because it's what I think of it as almost medication. It's what you do to keep yourself healthy, and it's essential. It's what allows you to be the best parent you can be, and it's what your children see you modeling for them. Even when it's small things, just saying, I just need 5 minutes. When it's walking away, those days when you're really irritable and cranky and are having trouble being nice to people, it's saying, modeling for your child, I'm in a bad mood right now, and I think it's probably showing up in the way I'm talking to you. I'm going to go step away for a few minutes so I can breathe deeply and come back to you and speak to you actually. You as the parent, as the authority figure doing these things, that's really powerful for the kids that you're raising. I used to use that when I was early in my career. I was working in a residential treatment facility, and I was in my early 20s, and I was working with teenage boys who were only a little bit younger than me, not much. So when it came to being an authority figure, there was only so much of that they were willing to grant me. I really had to earn it instead of being someone 10 years older who they immediately looked to as an authority figure. And one of the things that I found worked really well for them was modeling timeouts. Because let me tell you, when you tell a 16-year-old boy that he's losing his temper and he has to go take a timeout, usually doesn't go over real well. But what I found was that as I started modeling it, if something would go wrong in the milieu, or I would find myself getting annoyed. If I would model for them, I'm having a bad day. I'm irritated about this interaction we're having right now. I'm going to go take 5 minutes and sit somewhere quietly and then come back to you. I noticed they started doing it voluntarily too, as opposed to previously, before I started doing that, we'd tell them, oh, you have to go take a time out, and they would get furious and refuse, and that would be enough to start a fight. So just by modeling those self-care activities, children, adolescents, young adults, they start doing it on their own too. And I think sometimes you can gently suggest it. They may not think to do it, but by saying, I find in situations like this, what helps me is fill in the blank. You might think about trying that here. So let's talk about what self-care could look like. It's taking moments to celebrate wins, to really reflect on what you did well that day or in a specific encounter, to really feel like, hey, I controlled my temper, or I treated myself well, or this project went really well, or I set a great example for my child. Whatever that looks like, taking a moment to really give yourself kudos for that. Practicing self-compassion, you're gonna mess up. We all mess up. It's okay to mess up. My mom, still to this day, tells me about a time when I was 3 and she yelled at me. And she is still, I won't say how many years later, but many years later, is still beating herself up about the time she yelled at me when I was 3. I have no memory of this, but she is not practicing self-compassion. She's not forgiving herself for this. So, and I think it really probably colored her experiences throughout my childhood, that she felt so bad about having done this. So I think that you've got to, yes, you've got to do the best you can, but you've got to forgive yourself when your best is not as good as you hoped it would be. Or even when you fail occasionally to give it your best, you've got to forgive yourself. If if appropriate, apologize to the person you harmed, but also forgive yourself. Setting boundaries, we talked about those a moment ago. You know, a lot of times we feel like we have to say yes to all the things. There's, you know, pressures from the school, there's pressures from the other parents, there's pressure from society, and you've got to practice saying no. Saying no is a skill. It's not something that most of us are born good at. There's that need to people please, that need to make others happy, make them think well of us. And I'll be frank, I don't think there's as much judgment of us when we say no as we think there will be. You know, I'm sorry, I don't have time this week to contribute to the bake sale. No, I'm sorry, I don't have the ability to, you know, to come out with my friends tonight because I'm just tired, and self-care for me looks like watching my favorite TV show and going to bed. I think that's a great thing to do, and it's hard to do. The flip side of that, I know I just gave the example of saying I don't want to go out with friends, but the flip side is not passing up opportunities to spend time with loved ones when that's what you want to do, when that feels energizing to you. Don't say, oh, no, I've got to stay home and, you know, do housework or do this or do that. People are a lot less judgmental of what your house looks like than you think they are. They're a lot less judgmental of it than you are. And if you are focusing so much on that, you're missing opportunities to really take care of yourself by going out to dinner with a friend, or you know, grabbing coffee, or spending some time on the phone, or just going for a walk, whatever that looks like. I'm not saying pressure yourself to engage in social activities when you don't want to. I'm enough of an introvert that, you know, usually self-care for me is more saying, you know, no, I don't want to go out with a big group tonight. But at the same time, taking the opportunities when that sounds good to you, and don't talk yourself out of them because you think you should do something else. Paying attention to your entire self, that whole person approach. You're looking at physically, how do you feel? Paying attention to your physical health is a precursor to paying attention to your emotional health. The two are so entwined. And then the last, I've said it, is support. You know, to talk to your loved ones, talk to those people you trust, and say, I'm struggling today. And I think by doing so, you're achieving several things. One, you're allowing them to show up for you, to be there and to show that they care. Two, you're allowing them to share tips and things that have worked for them that maybe haven't occurred to you. Maybe you've never tried. Maybe they've got some great advice. Third, you're opening the door for them to say, oh my God, I'm struggling too. And to give them that sense of relief that this is okay to talk about. How often has a friend come to you and said, I'm struggling, can you just listen to me? And how great does it feel when that happens? By allowing your friends, your family to show up for you, you're doing them a favor. You're not just doing yourself a favor. You're not going to be a burden no matter what you feel like. All right, so let's talk about some of the resources that are available to you. Speaking of self-care, trying to stay hydrated. First of all, I want to talk about behavioral health providers. You know, we talked a little bit earlier in the webinar about the fact that faith-based counselors are not behavioral health providers, and I think that's really, really important to keep in mind. School counselors are also not mental health providers. They have a different educational track than mental health providers. It can get confusing because the word counselor or the word therapist is sometimes used interchangeably or loosely. So what we did is here we put together a list of some types of behavioral health providers. There's psychologists. Psychologists usually have a doctorate. They are particularly well trained in diagnosing. Some of them do therapy, some of them don't. So if you're looking for a complicated diagnosis, like if you think maybe, like for instance, autism, Psychologists are exactly who you'd want to go to diagnose that. Whereas something more, I don't want to say garden variety because that makes it sound simple and nothing, no behavioral health condition is simple when you're the one who has it. But if you're looking for something a little less complex, like depression, anxiety, you might go to a psychiatrist. Psychiatrist has been to medical school. They do not have training in therapy. They'll talk to you during your appointments, but they can't really do therapy. But they are very, very skilled diagnosticians. So they will be the ones who can apply the diagnosis to what's going on with you, and to prescribe medication for it. The majority of people with a mental health condition, well, it's a little over the majority, never get treated by a behavioral health clinician. In other words, they get treated by their primary care provider and never get referred to a specialist. Imagine if you needed surgery and the only person you saw was your primary care physician. You wouldn't get very good surgery. You probably wouldn't get surgery at all from that person because that's not their specialty. Same thing with primary care physicians. They can screen you for a behavioral health condition, but should be referring you to a behavioral health provider, to a specialist. So psychologists, psychiatrists, there's also, of course, specialists, child and adolescent psychiatrists. Those are not as common as we would like. They're definitely in short supply, and we need more of them around the country. But there are plenty, there are some in Florida. And if you're looking for one for your child, by all means, give Lucet a call. We can help you with that. There are adult psychiatrists who specialize in specific conditions. So, for instance, if you're dealing with depression, or if you're dealing with a substance use disorder, or you're dealing with, whatever it is you're dealing with, there are specialists even within psychiatry. There's also licensed clinical social workers. That's a master's level, usually, sometimes doctorate, but usually master's level clinician who does therapy. They do not prescribe medications. Same with a licensed professional counselor and a licensed marriage and family therapist. As you can guess from the title, if your issues are specifically related to marriage, to family issues, you might particularly with marital, you might lean toward a marriage and family therapist. But any of these last three could treat almost any of the same conditions. I would not get overly bogged down in worrying which of those last three credentials they have. But those last three, I tend to kind of lump them together. Like, as an example, I'm a licensed clinical social worker. I could very easily refer back and forth to the other two. What I couldn't do is the same work that a psychiatrist does, nor could she do the same work that I do. Those are very distinct. It is very common to see both a psychiatrist and a psychotherapist. And when I say psychotherapist, I mean those last three types: clinical social worker, licensed professional counselor, and licensed marriage or family therapist. All right, so those are the main categories of behavioral health providers. You'll notice, you see the person's name, the comma. Like, if you look right above my picture, it says Katherine Wooten, LCSW, BCBA, CCA. Those are my three licenses. You'll notice that they'll be different from state to state. So if you don't see it saying exactly LCSW, it might say LICSW or something like that. That's fine. They vary from state to state. So primary care providers, they can screen for behavioral health conditions. They can prescribe medication. They're fantastic at that. They are, you will not see those other providers being able to do that. Those other providers in the first column, except for psychiatrists. You can sometimes even get your actual full behavioral health diagnosis from them. Some of them are comfortable doing that. Others are not. They are really great at being able to tell you, or usually great at being able to see what they're supposed to, what's not. If it's kind of, again, I'd use this term with grain of salt, but if it's a kind of garden variety behavioral health condition, they're usually able to diagnose it. If it's something more complex, they'll usually refer you to a specialist for diagnosis. So once we've moved out of the kind of medical and healthcare profession, there are resources also you can use on your own. First of all, you've got resources through your health plan. Through Lucet, you've got access to behavioral health care management, which runs the gamut, everything from referring you to the providers you need, helping you find resources, creating a plan of care, and helping you set behavioral goals. And that might look like anything from, you know, I've been depressed and I'm struggling to leave the house. And they have you with goals like, all right, I want to, I'm going to set a goal of leaving the house 3 times a week for a walk and 1 time a week socially. You know, that might be the agreement you guys set, and they'll help you work on. Or like I said, it might look like referrals. It might look like helping you find an appointment. It might look like any number of things. Care navigation is a less intensive version of helping you find the resources you need. Those are bachelor's prepared individuals. They're not clinicians. The first bullet, the care management, those are master's prepared clinicians. Care navigators are who you get when you reach our call center and you say, I'm looking for a blank type provider. There's the Lucet Resource Center. You can click on the link that we're going to give you. That will take you there. And then you can, of course, always call 988, which is or 988lifeline.org if you prefer to do it online, which is the crisis lifeline. A lot of people think it's only if you're thinking about suicide, and that is not the case. If you are in crisis, if you are feeling really overwhelmed, you know, be generous with yourself in what you call a crisis. In other words, don't feel like, oh, well, I'm not thinking about killing myself, so I'd be wasting their time if I called. That is not the case. That is not the case at all. Give them a call. There's other really great community resources, such as the National Parent and Youth Helpline. That is not as much of a crisis line, more of just a support line. There's social media. I say that with a dose of, take it with a big grain of salt. You can find some great stuff online. You can also find some really harmful stuff online. So use good judgment. You know, like I said at the beginning of the call, I see a lot of parents criticizing each other in some of these groups. If you find one of those, please keep on moving, because you don't need that. Nobody needs that kind of nastiness in their head. But they can help you find local groups, local support groups. So I think that that's a great place to start. So here are just a few links that we wanted you to have access to and make sure we kind of ended with. And I'm going to turn the mic over to Patty for questions.
Thank you. Thank you so much, Katherine. That was wonderful information. A question came in, is there a place we parents can share supportive resources that are local to our Jacksonville headquarters for our Florida Blue GuideWell employees? I have some to share that really helped me and continue to help me even at 2+ years postpartum, but you'd probably never know they exist because they're on the newer side and there are not many out there to choose from besides standard therapy specifically for postpartum issues. So the question is there
for you?
For me, well, yeah. So I mean, I don't know about supportive resources for parents local to Jacksonville. I mean, I don't.
Well,
Debbie,
sorry, I was thinking about the question about. I was responding to your question about was there a place she could share what she knew.
Okay, Debbie. I think Debbie's got something
here. Yeah, hi there. My name is Debbie Delazari. I work here at Florida Blue and with the behavioral health team. And yes, there is several different options that we can do in sharing some resources, especially in the Florida Blue GuideWell kind of community. We do have options, whether it is on our mental health collaboration efforts that we have within our team, which is a local-based opportunity where we're able to share information about globally mental health. But we do also have some postpartum educational material. We have a Healthy Additions services that we provide here at Florida Blue to help new mothers or about to be mothers that would love to be able to share any information you have. So I can provide information, my own personal or email address, if that makes sense, or maybe it could be we can find a way of being able to get that information back.
Debbie, I can give this person your email. How about that?
Perfect. That sounds great.
I would really love to be able to get those to our case management team so that they can look into them and figure out when it would be appropriate, like which of our members it would be appropriate to share those with. Because if there's good resources out there, we definitely want to know about them. And if they're brand new ones, it's, as you've mentioned, it's entirely possible that we might not yet know about them. So I do love to be able to signal boost a really good resource out there.
Okay. Right now, so I don't know if anyone else has any questions. So that was the only one that came in so far. We had a couple people early on kind of commenting on what you were saying, but I didn't see any other questions come in. So let's give people a minute and see if anyone has any more questions.
Please ask questions or give comments or something. Don't leave me floundering up here.
So we had one comment come in when you were asking about kind of going over self-care for parents and whatever, and one comment came in and said it's important for parents to remember that allowing a child's behavior to trigger us is more often our fault for not enforcing boundaries sooner. Self-care as a parent requires we set and enforce boundaries consistently well before our patience is exhausted. So that came in.
What a wise comment. Yeah.
Yes. And we also had...
I feel like I want to put that on a T-shirt or something.
Yes, and somebody just said easier said than done. Yeah.
which is also very true.
Yeah.
Y'all, parenting is hard. I mean, it is a hard thing to do. It's really easy for me to sit up here and on my little camera and talk about, oh, you should do this, you should do that. But nobody should ever lose sight of the fact that everybody saying, you should, that doesn't make it easy to actually implement. And I recognize that.
Now,
which goes back to self-compassion.
Yes. Yeah. Okay, sorry, I saw one come in. How can we help our adult children?
Oh, I love that. And then I saw a follow-up question from someone else asking about adult children, about whether we'd have a webinar for that. I mean, I would certainly be open to that. I did a different webinar yesterday, and the same question came up. The question then was, what do you do if the one yesterday was about youth mental health, and it was, what do you do to support your youth? And so I said, but what do you do once they turn 21, 22, 18, whatever the age is, and they say, I'm done. I'm not engaging anymore in behavioral health treatment. And it was so heartbreaking listening to that parent say, what can I do? So that's a tough one. And I think it depends so much on the individual. I think if you can get them in family therapy, I mean, it's never too late. It can be multi-generational, and every generation can be adults. If you can get them in there, great. If you can't, I think even you going to therapy and kind of talking these things through, even though maybe you don't have a behavioral health concern, you still have a significant stressor in the form of your adult child's behavioral health condition. So maybe that would help with that.
Okay. I also said a question came in. Do you have any books or audiobooks or articles about boundaries I have 2 toddlers and I need some help?
That's such a great question. Off the top of my head, no. But if you would pop your email address in, first to ask that question, I will happily do some looking around, and I'll bet I can find something.
Oh, that'd be great.
2 toddlers is a lot. 2 toddlers is...
Oh, yeah.
You're exhausted, is my guess. I'm impressed you found the time and energy to come to this webinar, quite frankly.
Yeah. And then we also got can you do a session about teenagers? Okay. I will get that email address to you. Thank you so much for that. One of our employees just put in that she has a good book called Raising the Strong-Willed Child by James Dobson, that it helped her a ton. I can put that in for everyone. Okay. I'm assuming that maybe you did raise a strong-willed child. Okay, so I'll put that in.
And we know now that a lot of personality, such as being strong-willed, is inborn. I mean, it's kind of innate. We're pre-wired to have certain personality elements. We can influence those, but I think it used to be, you know, if a child grew up to be a certain way, oh well, it must be what the mother did, and we know now that's just silly. I mean, back in the day, when a child had autism, they said, oh well, that's a result of bad mothering,
right?
And just wild stuff like that.
That's true. Okay, let's see. Okay, so something came in. I found myself yelling at my 4-year-old daughter after work last week. I was frustrated because she didn't want to eat and she wouldn't sit down. I yelled at her so she can sit down and eat. She did listen, but then she asked me if I was happy now. That broke my heart. I wasn't sure how to handle it, but I yelled at her again yesterday. So if there's a book I could read, that would be fantastic.
That's so hard. The first thing that comes to mind is practicing self-compassion. You know, I'm of course immediately thinking of the example with my mom. I don't want you, we'll say 20 years later, thinking back, obviously I'm more than that, but thinking back on that, looking back on that and thinking, oh, I that one incident, I was a terrible mother. I failed my child. I ruined my child's life. At the same time, that is a behavior that needs to change. You need to figure out a way to not do that without feeling like you're a bad mom. So yeah, I feel like I'm going to be spending a lot of time on barnesandnoble.com after this. So just pop your email in and I'll look for that too. I'll see what I can find. And I'll talk to some of my colleagues because I do not specifically, that's not one of my specialties, that particular part of parenting. So let me talk to some of my people that I work with who really specialize in that, and we'll get you some good answers.
Yeah, okay.
And Katherine, if I could maybe just add on something also to that, I always think about, I'm a mom, LCSW, so I think about all those areas. I think one thing is that, good parents always question or feel they want to do something different or do something better for the kid. And that's a great sign of a parent. I mean, we are all human. We all have bad days. We all have, if I haven't eaten, if I haven't, had a stressful day myself, unfortunately, sometimes just those around you may be impacted. But I think, being respectful to yourself and just saying that, you recognize that's not what you want to do and you want to do better next time makes the biggest difference, because then you will, kind of make something a little bit different and try something next time, and just making a recognition of, hey, let me just take a minute, or if you feel that coming up, sometimes that's a great indication. Okay, let me take a breath before I react. All those little things, little baby steps are, again, you're just trying to be a better parent than you were yesterday. That's usually all I ask of myself every time, is just try to be better than yesterday.
Right.
And
Someone also
recognizing
just,
that when you lose your temper, it's often, I mean, it's because you care. You don't yell at someone
Yeah.
for not eating if you don't care. It's a sign of how much you love your child.
yes,
With channel it, yes, and with work,
yeah.
you will get there. But we all, no matter how hard we work at it, we all have days where we mess up.
Okay, so I see one more book. All these books that are being mentioned, and Katherine, if you find anything, tomorrow I'll send a follow-up email out so I can put all the, anything that anyone's mentioned in the follow-up email. Someone just said that they found the new Strong-Willed Child by James Dobson in Spotify audiobooks. And then also another book suggestion came in, Parenting with Love and Logic by Foster Klein, MD, and Jim Fay. Said it helped me to take the emotional aspect out of parenting and replace it with logically parenting, which helped my kids. And then we had a question come in, what about parenting kids on the spectrum? I have all three on the spectrum and it is overwhelming. Do you have any recommendations?
I do, and I'm very, very, very glad to see that question because one of the hats I wear at Lucet is I'm the senior director of our autism program. So this is a particular passion point of mine. I am hopeful that you are a Florida Blue member. If you are, we have so many resources for you included in your plan. I would really like it if you would, the person who asked the question about raising kids on the autism spectrum, if you would pop your email address in here. I would, and also indicate whether or not you're one of our members. I would very, very much like to have one of my clinicians reach out to you directly to provide resources and walk you through all the many, 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 many things we can do for you.
Okay. What I can do, Katherine, is I can send all the questions over to you. So I think we've gotten to all of them, but that way you can see all the comments and everything. I'll make sure if somebody even didn't put it in, because I have the email address of everybody who registered, I can pop their email addresses in for you for the people who ask for specific things. So, okay.
Wonderful.
Well, listen, we are just about at time, and we do have a very short survey. If you could take a moment and point your phone to the QR code or click on the survey link. Like I said, I will get a follow-up email out tomorrow to everybody. Okay. We've got some additional webinars.
Survey. It will help me tremendously.
Yeah, yes. It helps all of us to sort of understand whether the information was helpful, and if they have any comments, that's fine. And thank you so much, Katherine, for joining us today. It was very, very informative. So really appreciate your insights on trying to take care of yourself as a parent. So I will leave this up for a moment, but just wanted to tell everyone thank you for coming today and spending time with us, and have a wonderful rest of your day.